I'd like to paint a picture of the realities we're facing here in Wisconsin. We're reporting 3,503 new confirmed cases today of COVID-19. Our 7-day average of new daily cases is 2,963.
Recording in progress.
This is an increase up from 1,843 just 3.5 weeks ago. We're seeing daily numbers that we haven't seen since the end of 2020, and numbers that are higher than we saw at any time during September and October, which was the initial wave of infection caused by the Delta variant in the United States. Wisconsin continues to be at very high case activity level, with the majority of counties remaining in that category of very high transmission. But we expect to see a number of counties move into the critically high category today. Today, we're also reporting that 26 Wisconsin residents have died of COVID-19. Our total confirmed deaths have now reached 8,812. Our hearts continue to go out to the families and friends who have lost someone to this disease. Here's what this increased case activity means for our healthcare system. Statewide, 96% of our ICU beds and 99% of intermediate care beds are currently in use. That means that many of our hospitals are operating at their full capacity or will be at their capacity in the near future. This is the time of year when we typically see an increase in healthcare use from seasonal viruses like influenza and other respiratory viruses to holiday-related injuries and accidents. With so many hospitals and healthcare workers already overburdened caring for COVID-19 patients, it becomes increasingly more difficult to treat patients who come in for all the other reasons that people need hospitals and other healthcare settings. Our healthcare workers have worked tirelessly for nearly 2 years now as COVID-19 continues to spread through our communities, and now, unfortunately, appears to be once again accelerating. With a high level of disease transmission in Wisconsin, we need everyone who's not vaccinated to get the COVID-19 vaccine. The COVID-19 vaccine prevents and provides the best protection against serious illness, hospitalization, and death. And getting vaccinated can help ease the strain on our hospitals and our healthcare workers. We need all people to add additional layers of protection, including masking up indoors, staying home when you're feeling sick, and avoiding large indoor gatherings. Each of us can still take action within our own communities to help slow the spread of COVID-19. That I'd be happy to turn it over to our Bureau of Communicable Disease Director, Tracy Desalvo, for some additional content and data updates.
Thanks very much, Dr. Westergaard, and thanks to everyone who's joining us this afternoon. Wanted to give just a brief update on our COVID-19 vaccine data. As many of you may have seen, that data was last updated by us on November 5th. And just wanted to mention that we are continuing to work with Walgreens. There was a large number of cases, a large portion of vaccine data nationwide that Walgreens is working to do some updating to. And we, among other states, were affected, and our data was impacted by that. And so we are working very closely with them to get that data up to date. And we want to make sure that when we're providing you data on our website, it is really good, up-to-date data. So we do hope to have those updated numbers available for you very soon, but just wanted to let you know that that is still in progress. And this is a really normal thing. We work with a lot of different vendors, of course, who are providing us vaccine data, lots of vaccine providers. And they do routinely send corrections and updates to that data. So this is sort of part of that normal process, but because it is a larger number, it's having a bit of an impact on the overall system. So that's why you're seeing the hold on our data, and we're looking forward to getting you those updated numbers again very soon. And with that, I'm going to turn it back to Elizabeth. Or Jennifer. Sorry, Jennifer.
Not a problem. Thank you, Tracy. And we will now take questions. Please stay on mute until it is time to ask your question. *6 will mute and unmute your phone. And in the interest of time and to make sure everyone gets a chance to ask a question, please only one question per reporter. Then we'll begin this afternoon with Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, thanks for taking my question. Are people staying in the hospitals longer with COVID-19 than they previously were? And what exactly is the bar for admission with COVID-19 illness, and has that bar, so to speak, changed throughout the pandemic? Thank you very much.
For the first question, I have not seen any evidence that the duration of hospital stay for people with COVID-19 has changed substantially over time. I think generally speaking, there's acknowledgement that we've gotten better at treating COVID-19. We have therapies and we have treatment strategies that we didn't have at the beginning of 2020, for example. So I believe there are more resources for treating people, but there's a lot of variability, obviously, when people have severe disease and need to stay in the hospital ICU for a long period of time. But I don't know that there's a trend over time. In terms of the threshold for when a patient is hospitalized with COVID-19, that's really something that is up to individual clinicians making assessments, either in the emergency department or our outpatient clinic where people are evaluated. And the general requirement is that it's the safest thing for this patient. If they can be safely managed at home with monitoring and close follow-up, then the appropriate place for them is to be managed at home. If they can't get that safe monitoring and treatment any place other than a hospital, then they're admitted to the hospital. So those are standard approaches that providers are trained to make on a case-by-case basis.
Thank you for that. And we are aware that Dr. Westergaard is having some audio difficulties. If he can sign out and sign back in, we'll see if that will remedy that for that. And in the meantime, we'll move on with Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. I was wondering, I know that the vaccine data is hasn't been released for like a few days, but we have seen a few more groups now be eligible, such as the booster shots and the young kids between 5 and 11. Can you give any kind of update on where those numbers stand, or if you've seen how many young kids have gotten the shot in the state? Thank you.
Yep. Thanks very much for that question. We are happy to report that we are looking at that preliminary data as it's coming in, and we're seeing, tens of thousands of kids in that 5 to 11 age group who have received their first dose of COVID vaccine. So very happy to be able to report that. And we are also working on getting that data ready to be published on the DHS website. So look for that to be added to the big vaccine dashboard, that 5 to 11 group, in the near future. And then in terms of the booster dose information, also really good information to report on that front. We have over 550,000 people who have received a booster or additional dose. And that's some data that we hope to be able to release for you all on the DHS website again very soon. We just want to make sure that, as I mentioned before, that we have really good quality data to provide you when we give you those updates.
Thank you. Now to David Wahlberg from the Wisconsin State Journal. David?
Yeah, thank you. Dr. Westergaard, you kind of summed up the situation we're in, but I'm wondering, given the trajectory we're seeing, even with vaccination, that seems kind of similar to the trajectory we had last year at this time. Can you kind of compare where we are and what we might see during the holiday season this year with last year?
What we're very concerned about, looking at our epidemic curve from last fall and winter to this fall and winter, is that we're, November, December was the point during 2020 when things really started to accelerate. We saw more cases, more hospitalizations. Now we're in a very different place in the pandemic because we have a high degree of vaccination, particularly among older Wisconsin residents and people with medical vulnerabilities. So we've been hopeful over the summer and the fall that we'll be protected from the magnitude of the surge that we had last fall. And of course, we can't predict the future, but the trend we're seeing, I would say, from last week to this week is very concerning. and something that we need to watch very closely because the slope of the curve looks similar to what we saw last fall. We hope that the peak isn't nearly as high, but as I mentioned at the beginning, there's other things that make us much more concerned, which is that there are well, two things really. One is that we have other respiratory viruses circulating that we didn't have in 2020, most notably influenza. We're seeing influenza at low levels. We're seeing outbreaks of influenza in the Midwest and other places. So we know that flu is going to be circulating, although we don't yet know whether it's going to be a high activity influenza season or not, but that's a risk that we're very concerned about. The second thing is that our overall hospital capacity is strained. And we've had a lot of people, we've lost a lot of healthcare workers. I think as everyone knows, it's been reported that we've had early retirements. People are tired. Our hospitals are doing amazing work. As I mentioned, we're able to take care of extremely sick patients and provide very, very high levels of care, but our capacity to do so is finite. And the biggest tragedy that we in our state and our system will need to try to prevent is having our capacity stretched so thin that we can't save lives that we normally would be able to save. And that's why we need everyone's support to flatten the curve as much as we can, to get vaccinated if you're not vaccinated, to get your booster dose if you haven't gotten your booster dose, to get your influenza vaccine, and to continue to pay attention to all the ways in which we can prevent the spread of respiratory viruses that include flu and COVID, which is wear masks when you're indoors and you're in environments where you can't socially distance. That's going to remain an important part of our strategy, is wearing masks. Even as masking mandates have sort of gone away in some settings, it remains an important public health tool. So when we're looking forward, we're really trying to sound the alarm that COVID-19 epidemic is heating up, but overall, hospitals are strained and we need to do all that we can to protect our healthcare workers and protect our communities so that we can get everybody the care they need for whatever reason that they need care.
Thank you. Now to Katie Thorson from WXPR Radio in Rhinelander. Katie.
Hi, thank you. My question is, I know that the research is still very new about COVID-19 showing up in deer, but obviously we start the 9-day gun deer season this Saturday. So is there any health messages to hunters as they head out in terms of that?
Yes, thanks for that question. We actually did update the DHS website just this week on the Staying Safe in Your Community page. We've put up some specific information for deer hunters. We of course want to encourage deer hunters to practice all of the normal safety precautions we would talk about for COVID-19, including getting those vaccinations, wearing masks if you're in crowded indoor spaces or staying at a cabin with a different group of people who aren't your household members. And then there is, of course, studies that have come out recently about COVID occurring in deer. And we in the CDC really at this point don't think that there's a lot of evidence to show that there is going to be a lot of transmission from deer to humans. There's not a lot of data to support that. But we would continue to urge hunters just to use good practices and make sure you're being safe when you're handling deer meat and any raw meat, and using those really good food safety practices and taking care when you're handling any raw meat, including deer.
Thank you. Now to Joshua Peguero from WBAY-TV in Green Bay. Joshua?
Hi, thank you so much for taking my call. One of the questions I had, I know that the vaccination data isn't available, but you know, this is one of the first DHS meetings since we had here in Green Bay. Aaron Rodgers made those comments regarding vaccinations and put out some misinformation. Does DHS have any comment to that, like, you know, in terms of his comments, Aaron Rodgers' comments, but also just in encouraging people to get the vaccine and helping, you know, cut across some of that misinformation? Thank you.
So I would point, if we had, I've been muted. Does that mean Tracy wants to go first? Said the host muted me. Okay, all right. If you can hear me, I'll continue. I think the biggest single message, and we have, you know, updated our data on our website about this that I think should reach everyone in Wisconsin who's interested in this topic is that when we look at the rate of people who are getting hospitalized and the rate of people who are dying from COVID-19, people who are not fully vaccinated have a 15 times greater risk. So sometimes we talk about, a 50% increase of risk being a lot, or 100% being twice as much. This is 15 times greater risk. So by and large, people who are getting sickest in Wisconsin are people who are not yet fully vaccinated. And so the very simple message that gets to protecting people's personal health and the risk of severe disease, and also turning the tide against this new wave of infection because it prevents individual infections as well as severe diseases, to get vaccinated. The data are really very clear, and we have a lot of confidence in our recommendations that for everyone, getting vaccinated is the best decision you can make for your individual health, and also to contribute to slowing the transmission of COVID-19 in the community.
Thank you. Now to Alex Moe from wisbusiness.com. Alex?
Hi, thank you. I've seen that some states have authorized booster shots for all adults, despite the FDA and CDC not yet recommending or approving that move. Does Wisconsin have any plans to do that as well, or will the state be waiting for approval from the federal entities before authorizing boosters for all adults in the state? Thank you.
Yeah, that's a good question. Thank you. So we do not have a plan to change recommendations for who's eligible for a booster, because the FDA and the CDC will be meeting in the next several days to revisit and revise those recommendations based on new data. Some states have gone ahead really in response to the acceleration of disease that we're seeing, and gone and said everyone should get a booster. Simple messaging, vaccine-related immunity is known to wane over time. Simplest message is everyone should get a booster. The FDA and the CDC may move in that same direction, and we'll know that in a few days. We're not considering making any announcements in advance of that.
Thank you. Now to Will Cushman from PBS Wisconsin. Will?
Hi there. Thank you. Following up on that question, I am curious what your guidance might be for vaccinators who might have adults who aren't yet eligible to receive a booster, request a booster. What's your guidance for vaccinators in that type of situation? Should they go ahead and give that adult a booster shot or not? Thank you.
Yes, also a good question. So the recommendations for who should get a booster is somewhat complex. And I think that part of the discussion in the next few days will be how to make those recommendations clear and simpler to understand. Individuals who are 65 and older, who are 15 older and have a pre-existing medical condition should get boosters. We feel like the evidence of benefit is clear in those groups. Other groups, people who are 18 and older, may get a booster if they evaluate their own risk and come to the conclusion that they are at high risk. And the language was because of where they work, because they work in a setting where they're likely to be exposed to the virus, or they're in an institution. So we are allowing and encouraging people to evaluate their risk, and if they perceive themselves to be at elevated risk of COVID-19 because of any aspect of their life, where they work, where they sleep at night, or the activities that they do during the day, during this period of increased disease activity, people who are at high risk, which means people who are in the community, potentially exposed to people in unmasked settings and unable to social distance, can be at increased risk. So if people make that determination that their risk is elevated and want to get a booster, our recommendation is they can get a booster, and we should trust people's self-assessment of their risk. And so the instruction to vaccinators is to not turn people away because if they've made that their own risk assessment and feel like a booster is in their interest.
Thank you. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina?
Hi there. Thank you for taking my call. My question is in regards to the holidays coming up. Obviously, Thanksgiving is just a few weeks away. what are the recommendations to safely gather, and who is maybe safe to gather in a maskless setting and who isn't? Thank you.
So people who are fully vaccinated or people who have recovered from COVID-19 are less likely to be infectious and have a relatively lower risk, but not a non-zero risk of having and transmitting COVID-19. So people should take that information and make choices to go and get vaccinated, because that will lower their risk. Now, if someone is fully vaccinated at this point, they're not going to be able to complete their vaccine series by Thanksgiving. So it's important to be aware of people in your family and keep gatherings small. If people have symptoms that could be COVID-19, the recommendation is to stay home. And if you're around larger numbers of people, particularly those that are outside your household unit, the recommendation is to wear masks. So simple things, the things we've been saying all along: keep gathering small, wear masks if you can't social distance, get vaccinated, and avoid gatherings if you have symptoms. Those remain the important steps when you're getting together over the holidays.
Thank you. Now to Jenna Bree from NBC 26 in Green Bay. Jenna?
Good afternoon. My question is, are you finding that mask requirements in schools are working? Is it clear to DHS that based on data, generally Wisconsin schools requiring masks have lower case numbers than those without mask requirements? Thank you.
So thank you, Jenna. That question has been answered with data from a number of different states and published. So we believe that that's true, that schools with mask requirements have fewer cases. We've not done the type of careful study where you would draw conclusions in a scientific paper using data from Wisconsin, but we believe that question has been answered, and our recommendation remains during the school year for schools to have all students and staff wear masks while indoors.
Thank you, Jenna. Now to Gabrielle Mays from Fox 6 in Milwaukee. Gabrielle?
Thank you. My questions have been answered.
Okay, thank you. Now to Emerson Lehman from CBS 58 in Milwaukee. Emerson?
Yes, thank you. Following along with the school topic, in terms of with students heading home for the holiday break, is there a concern that we're going to see an outbreak in more schools throughout the state with masks or not following the holiday break and visiting family, large gatherings, family from out of town, things of that nature? Is there a concern amongst health officials seeing that surge in schools following the Thanksgiving break? Thank you.
Yeah, I would say that is a concern. We saw increases in our 7-day average of cases following last Thanksgiving and last Christmas. It's certainly highly plausible that when people get together in larger groups, that transmission occurs. So that's why we want to emphasize the prevention messages that we have. We do know that when people get together, and we've seen this with multiple holidays, it's been seen in multiple states, and that this is a risk factor. So we're urging people to exercise caution. If I could say one thing that probably gets overlooked is that mild symptoms, cold-like symptoms, in the setting of this pandemic, if we don't have access to testing, the safest thing is to stay home if you're not feeling well. I think sometimes we overlook that, and people go to work if they're feeling under the weather. This time of year in particular, with cases increasing, if people have symptoms, get tested, stay away from friends and family, and stay home from work while you have symptoms and while you're waiting for the result of the test. Tests are still widely available in healthcare settings and public health settings. So when people do get symptoms, get tested and stay home in the meantime is the strong recommendation.
Thank you. Now to Austin Montgomery from the Beloit Daily News. Austin?
Hi, thanks for taking my call. Just wanted to ask about the vaccination data. Wanted to see if there was a timeline for when that data might be updated. Thank you.
Thanks, Austin. We are working very hard, working with the vendor and working internally to make sure that that data is coming through again and that we have good quality data, and we do hope to have it up for you on the DHS website again very soon.
Thank you. Now to Natalie Eilbert from the Green Bay Press Gazette. Natalie?
Hi, good afternoon. Thank you for taking my call. When we first experienced the outbreak, there were a lot more testing sites, and it sounds like maybe there are fewer testing sites available per county. Is there any plans to change that and broaden testing sites pending the holiday?
I think we can have our comms team get back to you in terms of the actual number of testing sites, but I will just give a quick reminder that there are a lot of different ways to get tested beyond just the DHS or community-sponsored testing sites. There are certainly over-the-counter test kits that are available at pharmacies. There are a lot of pharmacies that are also testing sites. Going to your healthcare provider is certainly an option, and ordering at-home tests that come to you through the mail is another option. So just wanting to remind folks that there are a lot of different ways to get tested for COVID-19. And if you go to our DHS website, there's a lot of information and even a way to order a free test to be mailed to your home. So we can get back to you specifically on any plans to update those community test sites or sort of change the number that are happening. But a good opportunity to remind folks that there are a lot of ways to get tested, and if you have symptoms or are exposed, it's what we would recommend that you do.
Thank you. Now to Vanessa Reza from NBC 15 in Madison. Vanessa.
Hello, my question relates to illness after vaccination. So the COVID-19 data split by vaccination status. We noticed that there was a drop in likelihood for illness after vaccination from 20 times to 15 times. I was just wondering if you had any comments on that and could maybe elaborate on why we may be seeing that likelihood drop. Was it because more people are getting vaccinated or just less people are getting sick?
Yeah, thanks for that question. There are a number of factors that can impact that. One of which is that the percentage of people that are vaccinated in Wisconsin does continue to increase over time. And that's a really good thing, and that's what we want to see happening. So that can certainly have some impact, as you mentioned. And the other thing that can have an impact on this is just the overall number of cases. So in October, we did have a little bit of a decrease in cases and a leveling off for a little bit there. So in terms of actual numbers of cases as compared to September, it was down a little bit, which will impact those numbers as well. And will impact the ratio as you're looking at the fully vaccinated versus not fully vaccinated groups. So hopefully that helps. And I think the key as you're looking at this data, though, is that really we are still seeing a very significant increase in cases, in hospitalizations, and in deaths among people who are not fully vaccinated. And we really want to urge people to continue to go out and get their vaccines. It's not too late, and we would like to see the percentage of Wisconsinites vaccinated continue to increase.
Thank you. Now to Terry Sater from WISN TV in Milwaukee. Terry? Terry Sater? And a reminder, *6, unmute your phone. Once again, Terry Sater from WISN. Okay, we'll try to get to Terry later. Let's move on then to Talil Molhadine from WISC in Madison.
Hi.
Hi, who is this? Is this Talil?
Okay. Yes, I'm here. Can you hear me?
Yes, we can. Can we have your question, please?
Okay, great. I do. Yeah. So one thing that was mentioned is that the the rate continues to be high in a lot of counties in Wisconsin. So I wonder if you're seeing any patterns that would suggest that certain counties with higher vaccination rates who have mask mandates have continued to be in place. For example, Dane County was the first to institute a mask mandate. A mask mandate is currently in place county-wise, but cases are continuing to go up in Wisconsin. Have you been seeing any like stark differences between counties that are taking additional measures, or just because of the nature of how the virus spreads and how we are not exactly quarantining, that hasn't really made as much of a difference?
So what determines the community disease activity level of community is complex, and there are many things, and in epidemiology we're always, it's always a challenge to say that one thing causes another or is a main cause. So we are, if you want to look at county by county level incidence rate, those are broken down on our website. I will say, with the caveats that I just mentioned, that the counties that have the lowest activity rate, when I'm looking at it on my screen, are Dane County and Menominee County, which are our two counties that have among the highest vaccination rates. So we do believe there appears to be a strong correlation that's expected from what we know about how vaccines work from large clinical trials and population-based studies, that that vaccines prevent disease. So it stands to reason. And nationally, the northeast part of the country has higher vaccination rates and lower diseases. So not to oversimplify it, but in one sense it is very simple. Yes, vaccines prevent diseases. If we can have communities with very high levels of vaccine coverage, we're going to expect them to have less activity level. We're seeing that to some degree in our data, but there are also many other things that we need people to do to prevent disease, that we've mentioned. Mask wearing, as you mentioned, is one of them. Staying home when you're sick, and just being vigilant with how much exposure we are to people in closed indoor settings. So appreciate the question, and our simple response is that vaccines work. We encourage everybody to get them.
Thank you. Now to WKOW TV in Madison. WKOW. WKOW TV. Okay, we'll try once again for Terry Sater from WISN TV in Milwaukee. Terry?
Yes, thank you for my question. Dr. Westergaard, now that we're seeing a rise in cases for the second fall, can we now expect a COVID surge every fall in the years to come?
Yeah, it's a good question. The most respiratory viruses, like influenza and coronaviruses, of which the COVID-19 virus is one of those, do exactly that. They vary by season. So weather gets cold as people gather indoors. We see spikes, we see surges of respiratory viral infections in the fall and winter. So under the assumption that we don't eliminate this virus, which I think is a safe assumption, it's going to be here for a while, I think it's a safe assumption that transmission is going to increase in the fall and winter. Now, the thing that we have control over, though, is how much severe disease results from those infections that we see that might vary year to year. And that's going to depend on how we do with vaccination. If more people get vaccinated, when infections occur, it's going to be less severe. We're going to see fewer hospitalizations and future deaths. So I think a reasonable or a hopeful view of the future is that even if we don't get COVID-19 to go away, if this is something that we live with it as one of the many respiratory viruses that follow a seasonal variation. But because we're protected as a community through vaccination, it doesn't cause large amounts of severe disease. That's really what our goal is. And we get there by vaccination. primarily through the primary series, but increasingly as we're recognizing with booster doses. And I think that's something worth highlighting now, because many of the people who were eligible in the early phase are now due for boosters, and we encourage everyone 65 and older who were in the first wave of people who got vaccination to now get a booster dose, because immunity from vaccines, as we've learned, does seem to wane over time. Boosting can, again, prevent infections, make the immune system better able to respond to infection if it does occur, and prevent severe disease. So that's, I think, what we expect to see. And similar to how we every season emphasize influenza vaccine, I think in the future we're going to continue to talk about making sure that eligible people are immunized against COVID-19. We don't yet know whether COVID-19 is going to be an every year vaccine or whether a 3-dose series is going to do it. That's one of the interesting questions that only time will tell. We need more data for that. But at this moment, in this fall, the surge that we're starting to see, we have some pretty clear messages and clear data that we need more people vaccinated, and we need people who are in the older age group of over 65 to get a booster dose if you haven't already. That can really make the difference between the number of hospitalizations we see in the coming months as we see transmission start to increase again.
Thank you for that. And one last call for WKOW-TV in Madison. WKOW.
Yes. So across the state, according to your data, close to 91% of hospital beds and 93% of ICU beds are in use. And obviously that's according to your data. Is that typical? Or is that because of the increase in COVID rates?
So what our data show that most hospital beds are full. Interestingly, the hospital beds have been full for a long time, and hospitals are always have a majority of their beds that are occupied. That's sort of how they're designed. So we are seeing that in ICUs and intermediate care beds in particular, that occupancy rate has gone up in lockstep with the increase in COVID disease activity. We're also hearing anecdotally that in certain regions of the state, it's getting hard to find beds for patients, either beds in the hospital where they're presenting for care in the emergency department, or people who need a higher level of care. It's becoming more difficult to find a bed to transfer them for, either because they need an ICU bed or because they need a procedure at another facility. So this is what we mean by the hospital system being strained. When hospitals are operating near capacity, it can take longer, it can be more challenging to get people into the hospital bed that they need. The whole system of transferring and getting people approved for admission gets made more challenging, and that can put patients at risk if we're operating too close to capacity. So that is what we're seeing now. And as we mentioned in our early remarks, something that we really want people to keep in mind as we consider their urgency of getting vaccinated and preventing more hospitalizations from occurring.
Thank you. And that concludes today's briefing. Thank you to Tracy Desalvo and Dr. Ryan Westergaard for participating, and for all of you for joining us. Please continue to monitor the DHS website for data and guidance, and be safe and have a good afternoon.